Seasonal differences cause a lot of changes in our human body, especially the most vulnerable places that these seasonal changes are going to affect physically are the nose, ears, mouth, and tongue. Strep throat is one of the common issues that we face, especially when we have these seasonal differences and one season is being changed to another season. It can also be an issue, especially when you go to new places and while you're getting adapted to new environments. What is this strep throat? What kind of effects this strep throat is going to have on our human body? Let's learn it from Dr. Arvind today. My name is Varun. Welcome to Medica's video podcast. Today's topic is strep throat. Dr. Arvind is there with us to discuss about this strep throat. He's from Visakhapatnam. Those who are in Visakhapatnam area can directly visit his clinic in Akaipalam region. So he is available for in-person consultation there. And he's also available for online consultation on www.medicasapp.com. You can also download Medica's mobile application on your Play Store as well as App Store. Dr. Arvind, welcome to today's session. How are you doing?
So, Varunji, once again, thank you for inviting me. It's always been a
Thanks.
pleasure being associated with you and your team.
Thank you so much, sir.
So, hopefully, somebody will benefit something from this conversation that we are about to have.
Absolutely. That's all we are also intending to do, Dr. Arvind, as much as
Ji.
possible, give it back to the society. So, Dr. Arvind, strep throat. Uh,
Hmm.
there are a lot of reasons why we get this strep throat. The most irritating thing anyone could have is not being able to speak. And
Ji.
especially, even though you're able to speak, your voice is not sounding as soothing as it used to be. So, what are the main reasons for this strep throat, Dr. Arvind?
Yeah. So, strep throat, medically we call it as streptococcal pharyngitis, essentially meaning that there's an organism called streptococcus, particularly group A type of streptococcus, that infects the throat, which causes this condition. So this is a bacterial infection, and earlier it used to be even more prevalent before the advent of the antibiotic era. Nowadays, because we are using antibiotics left and right, it has lost its prominence somewhat. And for the benefit of mankind, I have to say. And nowadays, the viral infections are far more common, actually.
Right, right, doctor. So you kind of mentioned that we, after the invention of antibiotics, we are able to have this strep throat under control. So that's what you
Ji.
mentioned, doctor.
Hmm.
What I want to understand is how far this strep throat or this streptococcal virus, pardon me if I've said it that wrong, can take
Yeah, you
this
are
medical
absolutely perfect.
Right. Okay. Thank you. So,
Okay.
how far will it take a human body to an extent? What kind of damage it can do? Let's say if there is no antibiotic for this or a medicine for this.
Yeah. So, say for suppose you have no antibiotics and you also have a very weak immunity, let us say. So, since this affects the throat, what it can do? It can spread to your ears, it can spread to the nose, to your sinuses. It can affect the skin, where we call it as a condition called scarlet fever, where the skin becomes red, you get lots of rashes. It can enter the blood and spread whole throughout the body. So when the infection is very severe, we label it as septicemia or sepsis, where your body is utilizing all its available resources to fight this infection. If and for suppose your body loses this battle, you will die. So
Oh.
this is that far it can go, and that is one way where the infection burden is very severe very quickly, and you get this problem. The other way is it can lead to certain complications. Primarily it can cause a condition which we are very watchful about. It's called rheumatic fever, wherein the proteins from such organisms, they mimic our own body's proteins. So our body recognizes these proteins and thinks they are foreign, and since these proteins they mimic our body's proteins, our body attacks its own self. So
Okay.
most commonly it affects the heart and the joints. When it affects
Okay.
the heart, it's called a rheumatic heart disease, and it is one of the most common causes where a person who is not so old gets their heart surgery done.
Oh.
Like
Okay.
they say, valve replacement, valve repair, valve.
Right.
Whenever this problem comes, it affects the valves. It can also affect the skin, it can also affect the nerves, it can also affect the joints, but we're mostly worried about the heart and its valves.
Okay,
And
okay.
especially in children, where strep throat is more common, it can cause a condition called glomerulonephritis, where it causes damage to the kidneys also.
Oh, okay.
Mm.
So this actually triggers one more question to me, doctor. You
Ji.
kind of mentioned that there are medicines available for strep throat. But I'm
Mm.
not clearly sure if people are aware or they actually do go to a doctor for strep throats. Usually they settle with some home remedies and all. Do you advise
Mm.
people to go to a doctor and take a specific medication for strep throat, or
Mm.
does it usually fade away within time?
So usually what we say is you can wait up to 48 hours if it's not like if you're otherwise a healthy individual. You can say we will wait up to 48 hours. Within the 48 hours, we need to see an improving trend. So if your condition remains the same after 48 hours, or it's becoming worse, or you have other comorbidities like you have uncontrolled sugar, uncontrolled BP, or you're heart patient, then your threshold for waiting should be not so high. I will say
Okay.
maybe few hours or a day at the max. But otherwise, you can wait for 1 or 2 days.
Okay. So is it mandatory, Dr. Arvind, to take antibiotics for a strep throat, or are there any other medication that can subside these symptoms?
So, for suppose you're an otherwise healthy individual, your symptoms are not so irritating, you're unlikely to develop any complications, then home remedies like gargling with warm salt water, having lots and lots of warm liquids, then brushing your teeth, maintaining good oral hygiene, avoiding foods that are too sweet, too sour, or too cold, they definitely
Okay.
help. Usually,
Okay.
what people do instead of coming to a doctor, they go to a medical shop. So medical shop has n number of antibiotics, and somehow it is my observation, at least in the area that I live in, they only give the wrong possible antibiotic. Never I have seen, even in medical lottery, that
Right.
you are giving the wrong medicine always.
Right.
At
Right.
least
Right. I mean,
theoretically, at least one should give a good medicine. They're always wrong.
exactly. I mean, this is definitely very prevalent, especially in a country like India, that we believe in pharmacists more than the doctors. For various reasons, I wouldn't say it's a belief. Easy access, I would say, because you have lots
Exactly.
of pharmacists around you. You can just walk in and they're always welcoming. Rather than the doctor, obviously, is very busy. So I
Hmm.
think, ladies and gentlemen, try not to actually approach any pharmacist. Of course, there are also very good pharmacists who advise the right medicines to right people. However, it is always advisable, especially when it comes to antibiotics, to get them under a supervision of a licensed medical
Exactly.
practitioner
As you
because it's
have known, the antibiotic resistance is increasing dramatically because of our misuse.
exactly, doctor. We have been
So,
seeing that, especially during the COVID time, ivermectin has been used left, right, and center. Of course, I have no idea what is this
uh,
ivermectin all about. But then, see, I mean, everyone, if you ask, they know what is an ivermectin. They know what is this HCl. I think there is some terminology for that.
HCQ.
So HCQ exactly,
Yeah.
hydrochlorochloride. I think
Quid.
that's what it is. Yeah, exactly.
Hydrochloroquid.
Yeah, anyways, so coming back to this strep throat, doctor, you advised about some home remedies, right? Now,
Yes.
what we want to understand is this strep throat contagious?
Oh, yes. It spreads nearly in the same way as COVID. So,
Oh,
because it is in our upper respiratory tract, we call it URTI, upper respiratory tract infection.
okay.
So, anytime you cough, you sneeze, you generate some droplets. So, this bacteria hitches a ride on this droplet and it spreads. So,
Okay.
either you can directly inhale somebody who has coughed or sneezed on you, or because we live in a not slightly, we live in a very polite society with somewhat hygienes, so we cover our mouth while sneezing or coughing, but you have to wash your hands. If you don't wash your hands and give a shake hand to somebody else, then it is on their hands, and inadvertently they touch their eye, they put a finger in their nose, they put their hand in the mouth, and again they get the infection.
Right,
Or
right.
you might say you sneezed on a pen, you sneezed on a doorknob, and if an uninfected person comes and touches that, it gets onto their hands, and same way, we touch anywhere in the body, it starts entering you.
Right, right. So, Dr. Arvind, so there
Hmm.
is a myth again. When you get a certain infection, It is good to
Mm.
get that kind of an infection so that you will generate immunity for that. So is that the same for this streptococcal bacteria also? That if you get that once,
Yes,
it's good? Okay.
you do you do tend to get immunity, but like how long that immunity lasts and whether you will get a complication like this rheumatic heart disease or the glomerular nephritis where your kidney is affected is up for chance.
Okay.
So why do you want to risk it? Is one such thought that I get. But
Right.
usually, like all infections, immunity does prevail, and it prevents or at least softens the blow of the subsequent infection.
Okay, okay. So, lastly, Dr. Aravind, so we have a lot of working professionals, we have a lot of
Ji.
working women, working men, public private organizations. So, they get a lot of these strep throats because of a lot of things. Maybe they are, traveling outside, maybe dust
Mm.
related issues, water changes and everything else. If they get this strep throat, what would you, because they can't stop going to offices, they can't stop
Yes.
working. What is your advice to those people to ensure that they are safe and they are not affecting other people around them, especially when they go to work?
Yeah. So not infecting an uninfected person should be a primary goal. Hmm. That I think that's a basic common courtesy. So first thing you can do is always wear a mask when you're sick. Like COVID has taught us one thing, it is to wear.
Exactly.
Then second thing is you, in case you're unable to wear a mask, sneeze into your shirt or into your hands or into a handkerchief, and just don't leave your hand. If you are unable to like say have hand sanitizer at the standby, just a thorough wash with soap and water will do wonders.
Okay. Okay.
And
So
if
last
possible,
question.
you try to isolate yourself, distance yourself. Yes.
Okay. Okay. Great. So strep throat, how long will it take for it to actually get cured, doctor? Where we can come back to the normal talking or irritation gets less.
So if you take antibiotics, we say it's about 7 days. And if you don't use antibiotics, it is about 1 week. So
It's like a saying in one of the movies actually. I mean, that's a very nice way of putting it across. So no matter what, these bacterial infections will still take time. There is
yes.
one important question I want
Hmm.
to ask you, Dr. Arvind. I'm not sure if this is the right way to put it across. Antibiotics cannot cure bacterial infections. Is that
Antibiotics, so the sole purpose of an antibiotic is to cure bacterial infection. They cannot cure fungal, they cannot cure viral infections.
okay? Okay, okay,
So
got
the
it, got it.
entire antibiotic is a bio meaning an organism, which is a bacteria. So
Okay,
antibiotics entire existence is for eliminating bacterial infection.
okay.
That cannot be said for a fungal or a viral infection.
Right, right.
So
Thanks
what
for
we
just
see
that.
currently
Yes.
is that you get a viral infection and you're written a bunch of antibiotics. That does not
Exactly,
make
bro.
sense.
Exactly, exactly. That's been one of the recent trends as well. Especially when you go to a pharmacy or to any normal medical stores and all. This has been a very big trend, and a lot of people who doesn't know this subject are
Mm.
without hesitation they are taking these antibiotics and they're suppressing their immunology or immunal health. Anyways, Dr. Arvind, thank you so much for clarifying a lot of our doubts around this strep throat. It's been fun and wonderful interacting with you. I mean, the way you put it across is great and absolutely no fear. All the patients can approach you on a very friendly manner and you keep them very comfortable and safe. It's been wonderful discussing this subject with you again. Ladies and gentlemen, Dr. Arvind is available on medicasapp.com. Do not hesitate. He's a wonderful human being first and then a fantastic medical practitioner. He's going to make you feel very comfortable, clarifying and answering all your questions very patiently, and then help you come out of the situation whichever you are in. Dr. Arvind, thank you so one more time, and we shall reconnect for another subject very soon. Namaste.
Ji. Thank you, Medicast team, and thank you, Arun.
Thank you.